Right, the latest figures released a very short while ago. The health department says it has recorded 43 new COVID-19 related deaths in South Africa. That brings the death toll to 2,456. Minister Zweli Mkhize earlier extended his condolences to the families of the deceased. At the same time, the cumulative number of total cases in South Africa now stands at 138,134, while recoveries stand at nearly 69,000. The total number of new tests above 38,000. Meanwhile, the health minister says the Taxi Association's decision to defy government's lockdown regulations will backfire. Santaco announced earlier today that it would load passengers at full capacity from tomorrow. Minister Mkhize, however, says there will be serious health consequences.
South Africans need to understand that government is not just making rules. We're trying to save the nation from a rapidly increasing infection. And therefore, if we think that we can go against some of the guidelines, simply because we've got a right to defy, we can defy if we wish to, it's actually very unfortunate, because if what we're seeing now is the numbers that are increasing, wait for another 2 to 3 weeks, you are going to see the increase, the impact of the filling up of the taxis, and people who are walking there who will go into the taxi and not wear their mask and wait. If they see the police, they take it from their pockets, put it on, and then when the taxi passes the police, they put it back in their pocket. Those kinds of things are what's going to actually cause us a big problem. I think what is also important is for people to understand as well that at this point, what could have been done to reduce the numbers has actually been, to a great extent, been done through the first lockdown. But to reduce the numbers and save more lives, we need the change of behavior of our own people, and therefore it is really that our people need to take responsibility themselves. So this issue of filling up the taxis and people not, distancing and not wearing the mask is actually going to backfire on all of us. I do understand, I've got sympathies with the issues that are being discussed where there are differences of views in terms of what needs to be done. I do understand that, but there are ways of dealing with these issues without us getting ourselves into a problem. Masks alone are not enough to stop the spread of the infection. It's a totality of the combination of masks, hand sanitizers, distancing, and cough etiquette. All of those issues have to be seen together as a package that will help us to reduce the numbers.